assembly point until directed to reoccupy the building and only re-enter once the fire marshal is advised it's safe to do so. Please do not attempt to leave the site by vehicle until cleared to do so by the fire marshal to ensure access routes are kept clear for emergency vehicles. Please note this is a public meeting and that members of the public may be in attendance. The meeting will be recorded by the clerk and published online for public viewing. The taking of photographs, including screenshots, audio or video recordings, are not permitted during meetings unless with the express permission of the chair. Can members attending virtually activate their cameras where possible to enable you to join by video, and can all attendees mute their microphones when not speaking? Please do not come in during items unless I invite you to do so. If members attending virtually wish to speak at any point, please indicate by clicking on the raise your hand button. Members in the chamber should also raise their hand and I will bring you in at the appropriate time. If members have not been able to access all papers, please indicate. Today we will hear each of the items set out in the agenda. I will invite the officer to present the paper. Members will then have the opportunity to ask questions before we proceed to debate and decision. And I will now ask the clerk to take the roll call, Will, just to see if there's any apologies.
Thanks, Chair. We've only received apologies from Councillor Fairley, but we have Councillor Law substituting. Everyone else is in attendance apart from Councillor Benny.
Thanks very much. So we'll move on to item 3 in the agenda, which is the minutes of the last meeting, and we'll just go through those for accuracy. So page 7, page 8, page 9, page 10, page 11, and page 12. Are we all okay with that? We'll move on to item 4 on the agenda, and that is the internal audit plan 2025-26, and that will be presented by Sarah McPhee. Thanks, Sarah.
Its papers setting out our proposed programme of works for 25-26. The internal audit services are provided via a joint working agreement with Falkirk Council, and we're continuing work to agree a new working agreement for 25-26 with Click Manager Council, whilst undertaking a recruitment exercise to increase the own resources. Due to the annual assurance paper being reported as an exempt paper later in the meeting, the format of the internal audit plan has slightly been adjusted to incorporate the annual assurance level for the year to keep transparency. I draw your attention to paragraph 3.4, where we provided a limited assurance level for the Manager Council due to the consistency of limited assurances across the reports issued. At paragraph 4.4, you can see how the resources are split between our annual recurring exercises, our committed assignments and our other client work. Time is allocated to the Central Scotland Valuation Joint Board and the Click Manager and Stirling Integration Joint Board, although as detailed at paragraph 4.5, the role of the IJB Chief Internal Auditor is on a 3-yearly rotation, with the role transferring to Stirling Council from the 1st of April 2025. The plan must be considered flexible with GIAS, which will have heard previous use of the word SIAS, stating the audit manager should review and adjust the plan as necessary and in response to changes to the Council's business, risks, operations and priorities. Appendix 1 sets out our annual recurring assignments, with items numbers 2, 3 and 4 being included as an action from our external quality assessment undertaken by the Chief Internal Auditor of Argyll and Bute Council, which has been reported back to previous audit and scrutiny committees. Appendix 2 sets out our committed assignments, and Appendix 3 sets out our other client work. As already mentioned, the role of the Chief Internal Auditor for the IJB will be transferred to Stirling Council, but Click Manager Internal Audit may be required to provide an audit resource, taking that into account in the plan. So to finish, can I ask the committee approves the internal audit plan for the year, but to bear in mind the need to be flexible, and the internal audit will direct resources to where they're most needed. And thanks. I'm happy to take any questions.
Councillor Forson.
Yep, thanks, Sarah. I just want to ask some questions around about one of the items on the plan, and that's the Stirling and Click Manager City Region deal. I sit on that committee for the council, and I have been asking the committee about its audit plans in relation to the deal. We're now more than halfway through the deal. A significant amount of public money has been spent. We have one project in full delivery in Clip Manager and others currently in the delivery phase. And I'm just wondering when we will expect to see a report to this committee about the City Region deal. I mean, I notice here it's saying it's a high-level review to provide assurance to the committee. It would be helpful if we can have some input into what assurances that we might be looking for in relation to the City Region deal, and maybe have some input into the areas that will be audited, because I do have significant concerns about where we are in the deal, the amount of money that's been spent, and the delivery and the benefits that have been delivered as opposed to what was originally set out in the City Region deal.
Thank you. As far as I've been aware, Kevin's appeared, so he's obviously going to have more detail on this. The accountable body is Stirling Council, is that correct? So Stirling Council have an overriding audit to be doing first. We will, as an independent from Clerk Manager side of things, be looking at the Clerk Manager element. Kevin can possibly answer you a bit more than that.
Yeah, I was just going to come back on that. When I've asked the question at the audit committee, I'm told that the individual partners are responsible for auditing the projects within their own areas. And for me, I don't really see a route forward on how we bring that forward.
Through you, Chair. Thank you, Councillor Forson. In terms of the audit, it's been told Stirling is the lead for the deal in terms of the audit. They are preparing their timeline for that audit. It will come forward to not the joint committee this month, but the one following summer recess. That will set out the timeline for the overarching plan. We have agreed that each of the key partners within that, the University and Stirling Council ourselves, will then follow in terms of our plan behind that, but we need to follow suit from the overarching, in which case then the parameters of our scope will be outlined, and we will certainly come back to this committee as quickly as we can. We would have hoped to have had that here beforehand, but the overarching timeline hasn't been presented for us to then fall in behind that. So we really need that overarching timeline and scope to be presented by Stirling in terms of that to allow us then to fall in behind it. So we don't have that detail at present because that hasn't yet been shared with us by Stirling colleagues.
I don't know, I find this a bit woolly, and I kind of disagree a little bit, because certainly when I've pushed and asked the question, I am told that, we can audit, and I don't know why we have to wait on, kind of something coming forward from Stirling Council if we decide that we want to do a bit of kind of digger deeping on an issue from our perspective. I see, it's on the list there, but I would just be seeking some assurances that we can be asking questions on the areas that we are looking at, specifically around the benefits realisation and the kind of value for money, etc., and what the projects are delivering. But it does seem to be a bit of a buck passing, because when I'm asking at the committee, they're basically pushing it back, and now we're saying we're waiting on the committee coming forward. So I'd just like to kind of maybe get a wee bit more clarity. There's a City Region Deal Committee next week, so I will ask the same question in that forum as well. Thanks.
Through you, Chair, if I can just add to that. The item of the audit will be one of the agenda items at the meeting next week in terms of the joint committee. In terms of the parameters that we set for ours, we will have ownership in terms of the scope of that, but so is to make sure that it falls in with the wider piece of work that has been done. We really do need that overarching timeline. In terms of the points you've raised, if that is the areas where this particular committee wishes us to explore, we'll certainly make sure that that becomes the scope of the work that we will be taking forward in terms of the projects within Clip Manager's responsibility in that sense, but to be able to fall in line so that we are not deviating from that wider audit piece as well.
Yeah, just in the back of what Councillor Forson has said there, actually it was one of the questions I was going to ask as well, because of obviously, a lot of what's happening in the city region deal impacts a lot of our plans in Clackmannshire, so there's lots of things we want to take forward. I've always been concerned that lots of meetings have been cancelled, meetings have not gone ahead. So does that have the potential to delay our plans and then affect audit findings if we are not able to progress things that we had planned in our agenda?
In terms of the audit, obviously it is delaying some of the work that we would do in audit in terms of the city region deal, because we are awaiting that broader scope being done for the deal is a joint effort. In terms of the work and the impact, there is, and I think it has been reported to this committee previously, that there is a number of the projects that are planned for delivery within Clackmannshire. However, Clackmannshire Council is not the lead for those particular projects, and we do need to see how that will outturn in terms of those particular programmes. But we don't have that detail at present to be able to share.
Thanks, Chair. Just to follow up on that, I take it then that we can't anticipate the scope of the instruction that's coming from on high and start some of the work now so that we can complete it in a shorter timeline.
Through you, Chair, and thank you, Councillor Coyne. We haven't got any of the details from that broader scope in that sense to actually work from yet, so we are genuinely waiting for it. It was discussed at the last COB meeting as well, and certainly is something that we're pushing for from our colleagues in Stirling.
Yeah, but what I was actually asking was, could you anticipate it at all? Is your answer to that no, and that's why you're not starting any of the work just now?
Yes, that's the decision.
Thanks, Chair. Yeah, just a tiny point. The planned days that talked about on page 15, I take it those are man days? Yeah. Yeah. That's all right. No, yeah, that's fine. That's okay. That's just a wee one. Going down, further down that page, we were talking about the other client work, etc. And I've highlighted that there may still be a resource commitment required to undertake some of this audit work. Is that likely to have any implications, unbudgeted implications for Clackmannshire?
We've actually taken that into account in the other client days planned, 45 days. So we've taken into account the expectation that we'll be asked for resource already. If we're asked for any more resource, that's when it will be up for a discussion between the two internal audit managers, one at Stirling and internal audit manager, to discuss how many extra days are required and what impacts that might have. But certainly we've put in for scope for one audit to be done.
Yeah, for 45 days, fine. Okay. Another one. Yeah, coming to page 21. Right, yeah. Coming to page 21. National Fraud Initiative. Second paragraph talks about the gathering of data from services. The role of the key contact is to coordinate that. And I'm just wondering, are you getting the full cooperation that you require for that?
Clackmannshire Council this year have actually been quite exceptional and are ahead of their matches and investigations. I've been in regular contact with them via emails and phone calls this year, and they are closing off several of the reports really quite quickly, which is extremely encouraging this year. Everybody seems to be taking it on board. I've got no departments, as far as I'm aware, who are under-resourced and not dealing with it, so everybody's putting it into their day-to-day duties this year.
Thank you. On the next section, which is about consultancy work and contingency, and my question is do you assess, as part of the audit, do you assess the need for external consultants?
That area is not really for bringing in external consultants. It's for us as a consultancy. We don't like to say no to people. So if somebody wishes us to look over a guidance, a new guidance procedure, or they're wishing us to sit on any working groups, we would then look at that down as consultancy work. It's not part of our planned activity, but we are given then time, so we're not saying no to anybody.
Thanks very much. That hands that one on its head. It can, on page 23 now, can you just remind me why the follow-up and the review of purchase order assignments was postponed or deferred from 24-25? I just can't remember.
No, that one was postponed due to the additional work we had to do for the IGIB. There was 2 additional audits which will come out later on in the exam paper. So we literally just didn't have enough resources in order to tackle that one. We still had 3 ongoing at the end of the financial year, so that one unfortunately just got pushed on and deferred into the next year. We haven't forgotten about it. I believe work has currently started now, so it was first on the list to do.
Thanks very much. I think this might be the last one. Yeah, we're looking now at stores management. My question, I think I know what I'm talking about here. Have we had to do this kind of audit before? And if we have, what were the findings?
But as far as I'm aware, we haven't done a stores audit before, so this is the first one. This was identified to us from the strategic director, and we've taken it on board into this audit plan.
That's fine. Thanks very much. Thank you, Chair.
Page 24, the review of medications within schools. I don't know if this will fall under the scope of the audit, but I'm just trying to get to the bottom of it. Obviously, I'll give an example. My kid has hay fever. It's really bad at the moment. He's going to have to get medication that's given to him in school. In order to do that, I have to get it paid through minor ailments because he's got it on prescription. But it could cost me £4, but it'll cost the NHS a lot more money. My issue is that is a waste of money. I can get that myself, but in order for him to get it at school, it has to be prescribed by the doctor. So I know that I think that's due to the care inspector, but where can we kind of have this discussion of, it is wasting money basically in order to have it a little tick box for the school to be able to prescribe it. Where can we get these discussions to try and get this sorted out so that we're not wasting money?
It wasn't originally as planned in the scope of the audit to be looking at that. We were trying to look along the lines of what policies, procedures are in line for giving medicine to children, how often are they reviewed, and how is their best before dates, if you have such a thing of medicines, included into the procedure. But we could certainly look at the procedures and see how it deals with prescribed versus over the counter. It was probably something that has to be dealt with from the procedural point of view, and for the scope of that audit, we were looking at, are they sticking to the procedures and are they being followed? I'm not entirely sure if there's any education colleagues here who'd be able to look further into prescribed versus over-the-counter medicine.
Any other questions? No. Thank you very much. I'm happy to move the paper just formally. It looks like a wide range of work that's going to be taken forward and a good sort of range of work as well, so happy to see that. Can I have a seconder, please? Councillor Coyne, and now we're open to debate. Would anybody like to debate the paper? So are we happy to, I'll go back and see what we're, so are we happy to note the paper and approve the internal audit plan? Yes, okay, thank you. Thanks very much, Sarah. And we will now move on to paper item 5, internal audit actions progress report, and that is Chris who's going to present that. Thank you, Chris.
Thank you, Chair, and good morning, committee. This report invites the committee to note, comment on and challenge the progress of internal audit actions. It provides a summary of outstanding actions with Appendix 2 offering a more detailed update. As noted in a previous report that was presented to committee in June 2024, a total of 199 actions were identified, of which at that time 109 or 55% remained outstanding. The latest update shows that excluding newly added actions from the recent internal audit work, 155 of the original 199 actions, or 78%, have now been completed. Overall, of 315 actions identified, 224 have been completed, with 29% outstanding. The remaining actions are expected to be completed beyond their target dates, and efforts continue to ensure that all agreed internal audit recommendations are implemented in a timely manner. However, as I outlined to committee previously, we acknowledge that increasing service demands and resource constraints due to budget pressures continue to impact officers' ability to meet the agreed targets. To maintain momentum, there is a focus across our directorates on ensuring the progress is taken forward. The completion of audit actions remains a standing item on the Strategic Leadership Group and Directorate Senior Management Team meetings. Further update reports will be brought to the committee in the future, and Chair, officers from other directorates and I are happy to take any specific questions in advance of the paper being moved.
Thanks very much, Chris. Do we have any questions?
Yeah, I mean, it's not really for any one service, I suppose, Chris. There's an awful lot of red, kind of indicators on there, and that's worrying to see. But when you delve into it, it may just be one or two actions that are outstanding to move that on. I'm just wondering, would it not make sense for a focus from each service to be on, the areas that could actually move some of these red indicators to green, rather than try to do everything all at once, focus on one or two areas to move them on? That would certainly give me a bit more assurance that work's actually been undertaken. And there are two areas on there where no assurance has been given. I would have thought that those would have been the main priorities, kind of for the services to focus on, to move that no assurance to at least limited assurance. And I'm just looking for, I suppose, a bit of assurance for me that that is actually being undertaken.
Councillor Forth, yes, we would agree that focus to move this on is what we should be doing, and I'll take that up with the directors to ensure that focus is there. There has been additional work undertaken by internal audit colleagues on the Grade 1 recommendations, and a report will be coming back to committee in the near future in relation to that. So hopefully committee will have assurance there that the Grade 1 recommendations have been moved, and assurances there that we've met those.
Questions? Councillor Coyne?
Thank you, Chair. Chris, an overarching question on page 27, 3.4, which you alluded to a few minutes ago. 29% of 315 actions identified. Now, some of them go quite far back, and I'm just wondering, is there any evidence at all of deliberate obstruction here? I'm not asking to name names or anything, just in general.
No, absolutely not. I'd say that the report is generated and circulated regularly. There are genuine capacity issues. Some of the actions previously sat with one directorate, we have moved into another directorate. But no, there's no deliberate attempt by officers not to take these forward at all.
Right, thank you. Okay, just wondering about some of the stat. I mean, sundry debtors, for example, just to pick that one out, could be quite a significant issue. But that dates back to 2021, and it's only 37% complete. I mean, that, on the face of it, that strikes me as a bit weird. Is there a good reason for that?
That was one of the areas that previously sat under kind of the housing area, then moved into finance and revenues with the restructure. There's capacity issues within the finance and revenue section that's led to that, but the Chief Finance Officer has given assurances that that work is ongoing. We're just awaiting an update in relation to some of the procedures being in place, so she was coming back on that.
So does being that old shove it up the priority list a little bit?
I think it goes back to the point that Councillor Forson was raising just shortly in terms of having focused areas to move some of these on, rather than seeing the mass of the actions outstanding. Let's focus and make them a bit more easier to achieve and chunk them down.
Okay.
I was just, so sorry, I'll bring you in a minute, Brian. I was just wondering, like, considering some of these, I mean, I've been concerned for quite some time about the number of no unlimited assurance that we have, particularly as an Audit and Scrutiny Committee, that we don't want to be seeing that. But, bearing in mind that's quite a significant thing to have those limited assurances, are we prioritising areas where there's highest risk? So, for example, are we aligning that to our risk policy to ensure that we're putting those together?
Yes, absolutely. As I alluded to shortly, the grade 1 recommendations are our most serious recommendations, and a lot of work's been undertaken on that, and shouldn't these are closed off. As I say, colleagues from internal audit have done a follow-up review of the grade 1 recommendations, and that will come back to committee. So I'm hoping that we have seen an improvement in terms of assurance that these have been tackled and improvements across the council.
Councillor Quinn?
Thanks. Well, I think in my other job, if I had overdue actions for 4 years, I probably wouldn't have the job anymore. But I'm wondering, you're blaming a lot of, it sounds like you're saying there's resource. It's like, are we not doing anything to address the resource if it's been going on for so long? Is there outstanding roles we're trying to fill, or is there any other thing, other kind of things we're doing to try and address that so we can address these issues? Thanks.
So yes, we've reported in other committees with regards to some of the challenges that our council and every other council is facing across Scotland in terms of professional roles, whether it's accountants, health and safety, solicitors, planners, etc. We have sickness, quite high sickness levels as well. So there are a number of staffing issues in terms of that may lead to gaps in terms of, and then reprioritising a number of things that we're doing. So accounts, etc., treasury management, these types of things, transformation are all day-to-day activities as well. But I'm going back to Councillor Forson's point that we need to be more focused, chunk them down, and so that committee of assurances that these have been addressed and closed off more timely.
Thanks.
Councillor Coyne?
Thanks, Chair. Just wondering how you calculate the percentages, Chris. I'm looking at this table here, the coloured one, and it tells me that they're looking at IT and information security governance is 45% completed. And I'm looking now at page 32, which tells me that 15 of 16 items are outstanding. I would make an achievement of 6.25%, not 44. What am I missing?
So in terms of the report, so previous actions that were closed off are not on this because they've been closed off previously. So this report gives an update. So some of the actions before wouldn't have been closed off and now they have been closed off. So there will be items or actions that are not showing in this that we've previously reported on.
Since page 32 was written.
Since the previous report that came to Audit and Scrutiny Committee.
Any other questions? No. Well, I'd love to say I'm happy to move the paper. I'll move the paper. Unfortunately, it's been an ongoing concern for us, and I would love to see us coming back to assurances overall as a council. So we'll keep a close eye on this as a committee. Obviously pleased to see, and I've said this before, that we do look at these issues and we do scrutinise them and we do raise them. We're not trying to hide them in any way. So I think that's very important, and very pleased to see that the actions are being taken forward. So as I say, not really happy to move the paper, but moving the paper. Can I have a seconder, please? Yeah, Councillor Forson, and we're open to debate. Would anybody like to debate the paper?
Yeah, just to say that it does make sense to have a look at the areas where we could have some quick wins there and move from, kind of reds to at least ambers or greens. And again, the areas where there's no assurances, they've been there for some time now, and again, for me, they should be prioritised to move them forward so that we've got limited assurance. So Chris has said he's taking that forward, so there's another committee. It'll be after the recess now, but we'll look to see that progress is being made then. Thank you.
Councillor Quinn?
Thanks. No, I'm just wondering, obviously we see these things and they're standing a long time, and there is progress on a lot of items. So is there a better way to maybe, I'm just thinking, could we potentially display this in a better way when we have the next report to show, the difference or the improvement? Because something might be still outstanding, but maybe it's gone from 30 to 60% and it's made a big improvement, but if we just see it's only 60%, it maybe doesn't kind of reflect the work that's been done. Is there a way we could maybe, I'm just thinking, going forward, just kind of highlight the improvement since last time, or the recent improvement anyway, just so we can see, the areas where there might still be a lot of outstanding items, but there might be a lot of progress that's been made. And so, we know it's under control in that sense, that it's been worked on, and just I think that would maybe kind of be helpful if we have that. But yeah, but overall, I mean, there's a lot of information in here, so I really just kind of want to thank everyone for their work on doing this. There's a lot of things going on, and I do understand, like we have highlighted all the challenges. I understand there's a whole lot of things that make this a whole lot more difficult than we would like it to be. But yeah, I'm very happy with the report. It does have the information, but it's just maybe a suggestion. If we could have that, that might help us see how we're getting on. Thanks.
Yes.
I would endorse that actually completely, because one of the frustrations of this job is actually knowing what's happened since the last time we looked at something. And because that involves us doing a huge amount of research, digging out the old papers and looking at what was the last one, the last report say. I think it's quite important that what we want to look at is, since the last time when we debated this, what's happened. And if it's nothing, then there'll be questions will come out of that. But if it's a lot, then there'll be pats on the back. So it's important, I think, for us to do our job properly in assessing what progress is being made, not necessarily what's being made in the plan. Thank you.
Thank you. Okay, we're happy to, well, not happy to, but we're able to note the paper. Okay, thank you. We move on to item 6 on the agenda, which is the Health and Social Care Partnership Clickmanshire Locality Performance Report 2024-25, and that will be Wendy Forrest. Thank you, Wendy.
Thank you, Chair. Wendy Forrest, Head of Strategic Planning and Health Improvement for the Health and Social Care Partnership. Thank you for the opportunity to present this performance report to members this morning in terms of the performance over the last quarter of the Health and Social Care Partnership of the social work services delegated into the partnership by Clickmanshire Council. You will see this is a standard report which we've been presenting for a number of months now in relation to the performance that we think would be interesting. We have been asked previously to think about including stories from individual people within this report. We continue to strive to do that. However, with the need to ensure that we are collecting all of the delegated services, performance and information and data in relation to services, we haven't quite got there in terms of having that richness within this report. We have a number of delegated services where we are continuing to strive to get the data that would be relevant within this report, as opposed to the stories for individual people. I'm happy to take questions in relation to this. I could just draw a couple of interesting areas of work in terms of what we have achieved. We continue to be on a downward trajectory in terms of our delayed discharges. As of today, we have 5 people who are delayed within Forth Valley Hospital. Those are significant figures in terms of the national picture, and we continue to be a partnership which is on that downward trajectory, which I think is only 2 in Scotland. So we are working hard. Our operational colleagues are continuing to ensure that people spend as little time in hospital as is appropriate for them in terms of their clinical and medical needs, because we would always want to strive for people to be remaining independent at home within their communities. But I'm happy to take questions. Thank you.
Councillor Wilson.
Yeah, thanks. I mean, I do appreciate that these reports are evolving, and we've probably added things in here that are of most interest. Do you know what's missing from this report for me is the financial performance? Because obviously that's the kind of the question, some of the questions, particularly in relation, I think, in recent months. So I'm just wondering, is it possible to include some sort of financial performance within this report, or is that included somewhere else? It would make sense to me to have something in this report that's, kind of saying where we are in relation to budget, how we're delivering against savings, etc. And it just gives us, as the committee, the opportunity to be able to kind of interrogate that a wee bit. Thank you, Councillor Forson. I suppose we've been quite purist in the sense of the performance that we're talking about, which is the performance against services. I'm certainly happy to pick up a conversation. Oh, Ewan's coming. Ewan is the Chief Finance Officer, and if that's what we are seeking, then it might be helpful to be part of that wider context.
Thanks, Councillor Fortune. I think it was a really valid point. We can certainly look at how we do some of that. I guess the other part of it, so some of it's about the budget position, some of it's about savings performance. I think that the other bit is how we assess our assumptions around the plan to the realities we are facing as well, so we give a kind of rounded picture. We can certainly look at how we can build some proportionally in. Thanks.
Maybe if I clarify a wee bit, I know when we get reports from our services, we're able to see how they're performing against budget up to a place in time, what the outturn is. We're then able to ask questions about, how that might be brought back. Is there any areas of specific concern that's overspent? Is there any areas that's underspent? I just think that certainly for a council and for a partner who finances a lot of this work, it's difficult for me to see that performance kind of moving on. And when we get to budget times, that's certainly the areas that we're asking the questions around. And I totally agree that we should be asking the questions around areas of service performance. Are we meeting those targets, etc.? But the finance is really, really important.
Can I ask, just in terms of page 70, the number of sections that have taken place seems to have increased. So the first two sort of rows there, where it looks like the number of sections has increased from 45 to 60 or 23 to 34 in those two areas. And I wondered, obviously that's somebody in a mental health crisis, and I wondered if that's been taken into account when considering the overall mental health strategy. I mean, I had an experience, and I've raised this a number of times, I had an experience recently of being with somebody going through a mental health crisis, and there was great follow-up by the team and everything, but the problem was they were then told the outcome will probably be that they'll be given access to online CBT. And that really concerned me, that somebody that was getting to that stage of a mental health crisis, the outcome would be online CBT. And I've raised this before, and I just wondered if that risk would be taken into account with the new strategy.
Thanks, Councillor Rennie. It's a really interesting point in terms of the numbers increasing. As part of the strategy, we would absolutely need to think about what we are commissioning, and it needs to be a range of services which are in person, which are online, which are part of a wider thing. That's absolutely part of the role of a commissioning plan, which would fall out of the strategy, and that would be part of that work. So as part of the review of current performance and what people have told us, the current position for the mental health strategy is that the officers are collating all of the feedback from the service, and one of the overarching themes in there is that we need to think about our community services. What is it that we need to commission for people within the community, which we can have as a range of services, from very technical clinical services alongside those early intervention and prevention, and also the sustainable services within communities.
Thank you. Anything else? Councillor Coyne?
Thanks, Chair. On page 66 at 3.5, you mentioned it yourself, Wendy. There are some challenges accessing data which continue to be worked through to provide for reporting in future. What kind of challenges are these? Are these technical challenges, human challenges, process challenges? What's the issue here?
It's all three. So we have two social work recording systems which councils are looking to invest in and create, because the systems that we have do not reflect current legislation in terms of self-directed support and in terms of the Carers Act, and also to allow us to do that financial management of individual cases. But both councils have agreed to invest in that. We also have systems and processes within our services which are in need of refresh, and we've done a significant amount of work around standard operating procedures, around policy work. There have been policies come through Clough Manager Council in terms of how we operate, and in terms of how we actually, and I know that we have talked a lot at these meetings in general terms around capacity. We have a number of vacancies within our services within Clough Manager Councils, within social work, and we are endeavouring and striving to get those filled with the support of our HR colleagues across the system. So there's a number of things in terms of, Ewan's already mentioned need and demand, and we have significant, and I think when we did the briefing after the last meeting, we looked at the Scottish living wage, we looked at the numbers of people who are coming through and the increase in the numbers of people who are seeking care and support within the community, alongside significant cost increases, means that the budget that we have for this doesn't match the demand that's coming through the door. So Joanna's leading, as the Interim Chief Officer, is leading work around how we change that front door, how do we get to a much slicker system of multidisciplinary team working across our whole system, including social work and community health services, primary care, GPs, and that wider system. It's a very long-winded answer.
Better to be fuller than skimpy. Of the three, the last one that you mentioned there, which is largely budgetary, how does that directly seen as a challenge to accessing data?
So in terms of Councillor Forson's questions around how do we actually manage demand, we need to understand our totality of demand, how many people are coming through the door, how many people do we have in hospital, how many people, so that data is sitting on 3 separate systems at the bare minimum for us as a health and social care partnership. And so actually accessing all 3 of those systems, having performance targets on 3 separate systems, actually adds to the capacity issue that is required to manage that level and type of data. Thank you.
Excellent. Now, just having a look through the coloured charts, etc., a couple of observations. There's an awful lot of items where there's no current target set. That strikes me as kind of strange in a way. But also in others, there's no data available for last year. There may be a very good reason for that. I was wondering why in some slots there's no comparative data and in some slots there are no targets.
I think targets can be awkward when we're talking about people, for example, and some of the performance doesn't have a target because it's a monitoring position in relation to what we would have. If I use a very sensitive one, it would be something like adverse deaths. We would want to be recording the number of adverse deaths, but we would never have a target in relation to that. We would want to have a monitoring position. So some of these won't have those targets as a result of that. And in terms of no data being available, it goes back to the initial point, is that we are trying to gather everything that is within the delegated functions of the Integration Joint Board, and that is a task in itself, just because of where data has been stored and where teams are looking to put their information in despite collating that. But we are making significant strides with support from both councils and the Health Board in relation to that.
Thanks, that takes care of that, more or less. But if you're able to collect the data for 24, 25, why can't you collect it for 23, 24?
Because it may not have been there, it may not have been collected at that point, because it's dependent on what performance targets we're setting internally within the partnership.
Right.
Thanks, Laura. Can I just check, just when you were talking about the data, and obviously we're doing the social work system, can I just check that in the scope of the new social work system that it will be able to talk to these different places? Because I'm taking it as one of the issues that the current system can't talk to the other systems. And also if we're having to deal with, we're linked up with Stirling, that it will talk to their system or whatnot. Sorry, I keep hitting that mic.
Thanks, Councillor Law. That because neither system has been procured yet, we won't be clear of the functionality until those systems have been bought. There is an argument to be made that the system, as in the team around the individual, should be the place where we share that data and information. The recording and reporting of the information absolutely should sit in systems, but we cannot compel the 3 organisations to use the same systems that allow us to do that. So the focus of this has to be how we work as teams around individuals and share that data. It works really effectively in terms of GIRFEC, in terms of children. We can use GIRFE, which is the adults approach to this in terms of having that shared information for the individual, because it's not always appropriate to share information, for example, from police, from primary care GPs, mandatory social work. It's not always appropriate to share that across the whole system. So it's about how we effectively manage that assessment and review process.
Any other questions? Councillor Law?
Can I just ask, page 73, the percentage of clients with increased care hours at the end of local authority reablement services? Obviously, that's below target, but then the one below that on page 74 is, it seems that the clients with reduced hours at the end of it has gone up. So I just wondered, the ones who are obviously increased hours, is that because they've got a lot greater needs? And also the ones that have obviously reduced their hours, is there something positive happening there? Kind of just wondered if there was able to be a breakdown of that rather than just the numbers.
Yeah, absolutely. We can provide more detail, and you're absolutely right. And it goes back to that assessment process, and it's about that review and assessment process. So we invested in, with the support of the Integration Joint Board, in a review team, which is absolutely going through each of those packages of care and looking to see what people's needs are and ensuring that we're providing the right level and type of support for people. So you're absolutely right. If you go through a reablement service, it might be that you have an increase or a decrease in the level of care and support that you need based on that intervention.
And then page 75, just the percentage of adult support plans for carers completed in adult social care. It obviously looks considerably lower than target. Are we offering kind of online support while they're awaiting those plans? Just wanted to know that there was support there while they're waiting on those plans getting done.
Yeah, absolutely. So we've got a range of carer support through Mobilise, which is the online and telephone support service. We obviously have a care centre based within Clackmannanshire and Falkirk, and we also have citizen advice. We've invested in citizen advice so that people are getting income maximisation as carers as part of that process. So the assessment is about the care and support needs of the carer, but all of the other things can be met through other support and services.
Thank you. Just on page 72, and I've raised this at IJB, so apologies for duplication, but I just thought for scrutiny it's good to bring it here too. I noticed on the SDS options that the majority of SDS options are still sitting at option 3, which seems to be sort of missing out on the empowerment side of things. So I just wondered what work, and if there's work being done to sort of bring that into maybe options 1 and 2 being more prevalent.
Thank you, Councillor. Apologies. So I'm going to get a drink.
Wendy.
Thank you. My sincere apologies. Yeah, so in terms of SDS, it might be helpful that we have a briefing around all the work that's been done. There is significant work to train staff, to train the third sector, to be really clear about that. The reality, though, is not everybody wants to become an employer and to manage their own package of care. So it's about having the good conversation at the very start, and that's part of the work that's being done as part of the Social Work Front Door, and also as part of the multidisciplinary team huddles which are happening on a daily, weekly basis across Clackmannanshire and Stirling. Happy to do a briefing which would give you much more detail about the work that's being done. Happy to do that in terms of that, but I think there is significant work, but we do need to be mindful that not everybody wants to take, because it's a big commitment to become an employer, to take on the direct payments and the financial management of that. But what we can demonstrate, I hope better, is that we're having those good conversations very early in the process around it.
That'd be really helpful. Thanks so much, Wendy. Thank you. Any other questions, Councillor Law?
I was just on that point. I went to the Carers Day at Alloa Town Hall, and there was an organisation there that help people with self-directed care, and they had an online course, and then they could do an actual course for organisations. So I spoke to them and I thought, actually, that might be really good. I was going to say to the IJB as well, that maybe getting them in to do that, to find out more information, because I would like that. But I just wondered if that was something we could organise maybe for here, and obviously I'll speak to the IJB when we're there about that, but I thought that might be a good way to kind of tackle that.
Yeah, absolutely. We commissioned Self-Directed Sport Forth Valley to be our key partners. They are partners in the delivery of all the training we do with our internal and external commission staff. And so absolutely happy to pick that up with the Integration Joint Board and offer that up as a piece of work, because I think that the legislation has been around for a significant amount of time, but actually the principles of that good conversation and that good outcomes for people cannot be overestimated in all the work that we do.
Any other questions? No. No, thanks so much for that. And I mean, happy to move the paper, but obviously with the provisos that we said, that kind of, and I know capacity is a struggle at the moment, but in terms of having a wider report, maybe bringing in some financial elements, as Councillor Forson said, and some of that context, I think that's what we miss, and we've mentioned that before, like in terms of the different stories and more sort of behind the figures. I think can be really helpful to bring the report to life, but I understand that that's something that may be affected by capacity at the moment, so looking forward to that in the future. But thank you very much for coming along. Can we have a seconder?
Thank you.
Councillor Forson, yeah, we're open to debate. Would you like to debate the paper? No. No. Okay, we're happy to vote. Okay. On to item 7 on the agenda, Scottish Housing Regulator Annual Return of the Charter, and that will be Andy Bigger. Welcome, Andy. I see Terry's there as well. And Katie.
Thank you, Chair. Good morning, everyone. So this paper presents the Housing Service Annual Return of Charter for 2024-25. The return must be submitted in full to the Scottish Housing Regulator by the 31st of May each year, and due to the scheduling of the committee meetings and the volume of information required to be gathered to complete the return, it was not possible to provide a copy of the final return to committee ahead of submission to the regulator. Today, the day of the meeting is the earliest opportunity to present the data to committee. The Charter return measures housing performance by collecting data across a range of key indicators in various areas of housing service delivery, from repairs and maintenance to tenancy management, voids and allocations to rents and value for money. The list is extensive, and the Charter return gives a sound oversight of housing performance. The report summarises some of the key headline items from the return. Most notably, we've seen in the Scottish Housing Quality Standard, there has been a drop-off in the level of our compliance with the standard from 93% compliant to now 84.65% compliant. Sections 411 to 413 of the report set out the reasons for this change in position. Sections 4.15 to 4.17 highlight a really positive reduction in our gross rent arrears figures and describe in brief some of the actions taken to manage both our former and current tenant arrears cases. And sections 4.4 to 4.7 outline a significant reduction achieved in void rent loss, which is half from around 1.34% in 2023-24 to 0.7% in 24-25. This aligns with a reduction in the time taken to relay void properties from just over 64 days in 23-24 to just over 57 days in 2024-25. Appendix 1 provides the ARP submission in full, whilst Appendix 2 shows a comparative year-on-year performance over the past 6 years across a number of key Charter indicators. Scottish Housing Regulator recently carried out a review of the Charter indicators, and all social landlords in Scotland were invited to take part in the consultation on this. The findings of the review resulted in a number of changes to the Charter indicators reported on, and these are set out in Appendix 3. Thank you, and I'm happy to take any questions that members may have along with colleagues from Housing. Thank you.
Do you have any questions, Councillor Coyne?
Thank you, Chair. And the 3.6 on page 78, We must inform the committee that despite repeated requests, we have no progress with Civica. What's plan B?
Thanks, Councillor Coyne. Yeah, it's been a bit of a source of frustration, this one, that our early engagements with Civica have not been as fruitful as we'd expected, or as proactive as we would have expected. Plan B is that we have, at the moment, we are working with NEC, who are providing the updated housing functionality, so the updated housing IT system. So two parts to this: the NEC providing the housing IT upgrade, Civica providing the property element of the IT upgrade. NEC have capability to do the whole thing, so that is an option. There's also potentially option, if it comes to it, obviously Type 1 is the finance system that we have here at the Council. Type 1 are exploring and developing asset management and property related functionality in their system. That could be an option. So there's a couple of things there potentially that we could look to move to with providers that we already have on contracts. And there are obviously a range of other providers in the market that, if it came to that, we could look at that. But I would hope that we can progress things with Civica and get us to a place where we want to be before we have to look at those other plans.
Do you have any contractual snags or drags with Civica? Obligations to them in any way?
Potentially, yeah. I mean, that is obviously a factor that we are contracted with Civica to deliver this piece of work, so we would explore all avenues through that contractual arrangement first before we looked at any other potential other options. But there are mechanisms clearly through an agreed contract that we could look to progress to take forward before we looked at other alternatives. But that is potentially something that we, not potentially, it's certainly something we'll have to consider.
Yeah, I mean, it looks on the face of it as if they've got to be in breach already, I guess. And they must have contracted to respond within certain periods, etc. I would have thought. Anyway, that's for you guys to sort out. Going down to 4.3, talking about the large-scale tenant survey. I might be wrong, but I seem to recall from previous conversations on this topic that the participation percentage was pretty low, and that we were questioning whether what the answers were actually representative of the actual intentions or wishes of the tenant body. So what changes are you proposing to make to the capture, the data capture, to make it more representative?
You're quite right, and in some surveys we do receive quite a low response rate. This isn't one of them. This is one that we actually get a very good response rate. What we do is we externally contract our consultant to come in, and it is literally door-to-door chats that take place. 1,000 surveys, 1,000 responses are gained from that. So that was undertaken last in 2022-23, and we gained 1,000 responses. And the plan of action will be to do the same again. We found that we had a better level of engagement when we undertook the survey activity in that period between kind of March and May, where hopefully the weather's a little better, whereas in previous years we'd undertaken it in the kind of alternate winter period. As I say, although we gained 1,000 responses to the survey, we did find tenants to be more engaging during that kind of Easter type, early summer period. So we don't anticipate any issues progressing again along the same road and gaining that 1,000 surveys, which is a really good proportion of the tenant base.
Now that's a good return of 20%, basically. But how do you select the 1,000? Are they selected randomly, or do you just take the first 1,000 people who bother to apply, or whatever? How random is it?
Yeah, we provide the consultant with a broad range of data that we hold on the tenant base, on the stock type, a whole range of different variables and factors, and from that they generate a survey programme which captures, hopefully, a broad spectrum of the tenant base across a broad spectrum of different 11 different types of property across the county.
I'll see for the moment.
Councillor Quinn?
Thank you. Question now on page 79, 4.11. Obviously with a drop in because of the EPCs. So how did that happen? And how can you tell us just a little bit more information about what's going on there and what's happened at that point and why it's dropped so much?
Yeah, sure. Human error, to be honest. It wasn't picked up through the database. So we have a team that manage EPC compliance within housing, and we had a programme of activity to undertake energy performance certificate surveys across the stock. And these properties, unfortunately, were missed in that programme. So it comes down to human error, not having identified in the database that these properties were due a renewed survey, which is really frustrating and unfortunate, given that we've worked so hard to recover our SHQS position. When you look at the immediate post-pandemic position, it was 39.4%. We dropped really quite far back there in SHQS compliance. We worked really hard to get it back up to around about 94% compliant. So it's disappointing that it's then dropped back to 84% again. But we do have a programme in place to recover the position. We're working toward a programme which will hopefully see us having recovered the position by October, November this year, in line with when we will report the annual return, the annual assurance statement to the regulator. Another thing I would say is that it is, although an energy performance certificate is clearly something that is important and we need to keep up to date, there is no deterioration or drop off in fabric condition of the building. As the certification has dropped out of date and there's been no material change to the properties.
Yeah, no, that's good. I understand it's just what it is. But yeah, I'm just wondering then if it's caused by human error, if we've done stuff, and said we've done things that are planned to address, to bring us back up, is there something when we can put in place, or we have done for the process, or to make sure that can't be missed again, or that we have checks in place to avoid it getting missed in the future?
Yes, certainly. We have made an adjustment to the database where the information is contained so that there is a greater level of flagging in the system, or that the system flags up more visibly when these EPCs are due to expire or have expired. So we have made a tweak there, and there has been a renewed focus on that area of activity.
Excellent, thank you. That all sounds really good. Just one more item I just wanted to ask you about as well on the previous page 78, item 4.4, the number of days to re-let void properties, and it's made a big improvement over the period. Do you expect it to continue to improve? Is there any more scope to improve with there? Can you tell us a little bit about kind of what we're expecting going forward, or what we're doing to kind of make that even better? Thanks.
Thanks. Yeah, it is good progress clearly that we have managed to reduce that turnaround time, but we do feel there is scope to improve on that. Post-pandemic, we were able to turn properties around anywhere between 33 and 35 days. At that time, that was among the best in the country for the turnaround time. So that's where really we're looking to get back to that. There's a lot of challenges, as we know, in turnaround void properties, a lot of variables. We have had a number, as we know from recent past, we have had a number of properties that have been sitting for quite some period of time, requiring quite a bit of work to be done to them, and that has pushed up some of the end-to-end time averages when it goes through the system and the RV let. We're coming through that, we have come through that largely, and we can see that in the improved performance. But certainly, yeah, as we move forward, we'll be looking to drive the turnaround time on these voids down as low as we can do, and get back to around about that figure where we were performing as best in company around about the kind of mid-30s in our end-to-end time.
Thank you.
Thanks, Norma.
4.10, the apprenticeships. How many apprentices did we actually have?
Thank you. Apprentices, in terms of currently we have 6 apprentices at the moment, which equates to around 5% of the trades workforce. In previous years we have had a little more than that. We've had kind of a little bit double that actually to 10% of the trades workforce. We have retained most of those apprentices, almost all actually. We've offered a position too. There have been some that have chosen to go leave the authority to work elsewhere, but we have, as the paper suggests, 100% in the last year recruitment and retention rate against the apprentices. So as an area that we're looking to grow, but 6 at the moment is what we're comfortable in terms of managing, as you understand and appreciate. There's quite a lot of work goes into the wraparound support that apprentices require. So 6 is what we feel that we can comfortably manage at the moment, but we will look to grow that area when, and if possible in future, to develop and increase that number.
Is that just like a single trade, like an electrician or a joiner, or is it kind of spread about, or or are they all on the kind of same programme sort of thing?
These ones at the moment are largely electricians. Historically, we've had a range of different trades. It really depends upon the requirements at the time. When we're looking to recruit, where we feel that we need to inject some additional numbers, but also looking at the future and the workforce development and plans. But at present, these 6 are largely electrical apprentices.
Just going down to page 110 about the percentage of court actions initiated which resulted in eviction. I just wondered, what's the percentage or the number that the court didn't side with us? And do we know, was there any specific reason as to why the action that was rejected by the court?
Thanks, Councillor Law. I don't have any specific reasons for that. It's something we can look at. Obviously it's up to the sheriff what they grant and don't grant. It could be that they feel that the person's made a suitable agreement and then the case is dismissed. That's probably the most reasonable assumption, but I can certainly look at that and get some detailed here.
Thanks. A follow-up, Andy, to Councillor Law's question about the apprentices. Does training an apprentice represent a significant investment on behalf of the council? And if it does, what measures can you take to retain them beyond? And I know you've retained these 6. Do you have measures in place to stop them swanning off and taking your investment and giving it to someone else as a benefit?
Thanks, Councillor Coyne. I think the most significant investment is the time that's spent working with the apprentices as opposed to the monetary value associated with it. I think there's a great deal of time spent, as I say, not just from the officers at Kellybank, but with the colleges and additional support that comes from other colleagues corporately. But there is clearly a lot of investment goes into that time, the wraparound support, etc. I don't think, to be perfectly honest with you, it's very few, although I'd mentioned that we had lost some recently to other organisations. Very few do actually move on and go elsewhere. The very vast majority of apprentices that come through stay with the council, and not just for the short period we do have a number of apprentices that stay with us for quite some considerable period of time, if not actually their entire career, going back with some of our early apprentices. So yeah, I think it is a good point that you raise about potential safeguards against the loss of investment, whether it be time or monetary. It's something that I don't know, potentially could be looked at in the future, but I think certainly the retention levels are excellent, and I would say that the investment is largely time, onus on the time as opposed to looking at monetary value.
Kevin,
Thanks, Councillor Coyne. Apprenticeships is certainly something that I'm keen to explore. We had recent discussions at our recent anchor partnership around about apprenticeships and how we can grow some of those. And whilst it would be great if we would be able to guarantee people a pathway into employment with the council, that may not always be possible going forward, but I think the ability that the council can give in terms of training apprenticeships, particularly for local young folk and even adult apprenticeships for the locality to support employability. And there we know that there's certainly a demand for a number of sectors, particularly the trades, and I'm really keen to explore that and look at how we can utilise the resource that we do have to support that, and also some of our workforce planning challenges. We do have an ageing workforce, and certainly I am keen to look at how we can support that through the apprenticeship programmes and expand on what we currently do. That will need some planning in terms of how we can manage that within our structures in that sense. And whilst it may not always provide a permanent post at the end, it will certainly give people qualifications and the experience to go out there and seek employment elsewhere, hopefully within the county, and support others within the sector.
Sounds to me that if you could cross-charge that to employability and they can record it as a win, So it's just an idea. Another question on voids. Do you have a triage system for voids whereby you don't do them in sequential order as they go in, but you say how many voids can we get back on letting for the least amount of money? You do the quick fixes, pick the low hanging fruit. I'm assuming you do that.
Thanks, Councillor Coyne. Yeah, we operate a system where we work to a top 14 void properties. So we meet weekly. The housing and the property teams are weekly meeting every Wednesday, and we review the properties that we have on the go at the moment, the properties to be refurbed and the priority properties based on the allocations and the need basis. So we look at those top 14 and we work across those primarily. That's where our focus is. If there are other properties out with that top 14 that are identified for whatever reason as being properties that we can quickly return and it's of benefit, we're not just going to quickly return them and have them sitting there for a few weeks, then we would look to move to do that and be agile enough to do that. But we tend to focus our work on the top 14 that have been identified, and that is, as I say, regularly discussed every week. It's reviewed and updated in terms of where are we progress, and do we need to adjust or alter that top 14 in any way.
If I'm a house, how do I get into the top 14?
It's largely driven by the need. So where have we got greatest demand? So
like a 3-bedroom.
Yeah. So you would need to know, if you're the house, you would need to know how in demand, who's looking for you, what type of property they need to be. So yeah, it's based on where the need and demand is.
Councillor Law. Page 113, the adaptions, obviously it was a significant movement on that. I just wondered how many related to, delayed discharge with hospital. Was there any kind of consequences involved there?
Don't have that level of detail, Councillor Law, but we could look at that, certainly the caseload to understand where the cases have arisen from and what's called discharges. We could look at that for you. I don't have that level of detail here today, I'm afraid, but we have seen significant progress in adaptation work undertaken and a real reduction in the waiting list and the waiting list times. That's really been driven down over the last year, 18 months, so it's a significant improvement in that area. But I can get that final detail for you.
Do you engage with health and social care colleagues in order to make sure that if there is a significant block in those ones, I take it those processes are in place?
Through you, Chair. Thanks, Councillor Law. So we are working very closely with colleagues in the Health and Social Care Partnership, and actually are reviewing our procedure and policy and approach to this area. At present, there's a number of cases that we are currently reviewing at present to look to push them forward in terms of trying at pace to try and process this backlog. So yeah, there's regular engagement in play and joint work in developing that policy and approach to address this.
Page 126, amount and percentage of former tenants' rent arrears which written off at the end of the year. This has been raised with me before because I think sometimes there's this assumption that it's written off within the year, and I don't believe that is the case from my knowledge. It goes through quite a number of steps, and I think it has been covered other areas, but just because it's here, I just think it was important to raise that. If you could kind of explain the kind of steps that had been taken before this amount would be written off.
Yeah, absolutely. No, you're quite right. They aren't just written off within the year. For write-offs to occur due to a length of time or a time period, it would have to be time barred, so anything 5 years, greater than 5 years historically. But there's also untraceable persons or deaths that are in the mix. There's a few different reasons why something would be written off and not able to be recovered, but you're right and that it would just be immediately moved to a write-off position in here. It is historical debt that is, as I say, 5 years. We can go back 5 years to recover debt that we are is owed to us. So there's a set process and criteria that would be followed. We do have a real focus on this area. We have a team specifically looking at former tenant arrears. We have a database that is a work in progress at the moment, but is fairly well along the track to have all of these separate kind of areas in former tenant arrears set out clearly and managed through the process. And we've recently seen some really good success in recovery of historical debt, where we've been writing out to former tenants, and we've been gaining a good response on that. So that's a positive.
And I take it current tenants who are facing financial hardship, that they're struggling with it, the best thing for them to do is contact their housing officer, because then you can come to some sort of plan so that it doesn't kind of escalate and whatnot. There is that kind of process there in place, isn't there?
Yes, Councillor Law, and I think some of you may remember a couple of years ago we done a little activity on evictions of that year. I think that was 22-23, and I think at that point, out of those evicted, there was something like 1,250 contact attempts. So we've done that activity again to look to see how many of those, I think it was 25 evictions this year, to see how many contact attempts to and from the tenant. But say 9% of contact attempts are from ourselves to the tenant. And out of those 25 cases, there was 1,591 contacts. So I think that's really substantial. It just shows the efforts the officers put to try and get engagement and get them the right support. You know, if they are finding financial hardship, get them, referred to other agencies, whether that's CAB or any other support they require. And what I would say is that, when we spoke about the kind of evictions a minute ago, of those cases, there's kind of two stages up until the conjoined paperwork served to legal to go and take the legal action against that tenant. But after that, 701 contacts are made after that paperwork is served. So again, even at the point where we're saying, right, we want to take legal action against this tenant, we are still trying to get some sort of arrangement, because we understand and appreciate that it's actually better for people to stay in their tenancies and recover the debt. So I say about that early engagement. I think we've spoken about that a number of times, but yeah, getting in there early to ensure that it doesn't get to a point where it's unmanageable.
Is that communicated to our current tenants? Because I think when I spoke to a few, that was their gripe was, our rent's getting put up 10%, and we're seeing this amount getting written off. And I think to explain that to them, to communicate to them that there is all these steps that you're not just going. We're not going after that. Are we communicating that to our current tenants so that they are aware of what the steps are getting taken?
Yes, I would say that we are. Obviously, this year we've got our kind of budget build up for next year's rent increases, and we've got a number of engagement sessions coming up, gala days, community carnival, a house and open day, that we can certainly put that across to tenants. But what I also would say is that in the kind of policy development plan, we're looking at our arrears policy as well. So that will give us an opportunity to work with tenants to get that arrears policy and really get that information out there to people to say this is what the arrears policy looks like and the steps that we take in an arrears case.
Any other questions? No?
Well, really happy to move this paper actually, because it's really good to see that it's a sort of external sample, which is great, so it means that it's really independent, but also to see actually, I noticed as I went through the paper the high level of satisfaction from tenants, which was really positive to see. And obviously we know the issues that are there that colleagues have raised, which I was really pleased to see colleagues raise, but we know that in general our tenants are happy, and I think that's really positive, so very happy to move this paper. Can I have a second, Councillor Coyne? We're open to debate. Would anybody like to debate the paper? No? We're happy to note? Okay, thank you very much, colleagues. Now we want to item 8 on the agenda, the Manchester Child Protection Committee annual report, and that will be Sharon Robertson. Thank you.
morning, everyone. So I'm here today to present the Clerk Manager Child Protection Committee annual report. It's for the period of 23-24, and I'm doing this on behalf of our independent chair of our Clerk Manager Child Protection Committee, Cecilia Meakin, who unfortunately isn't able to be at the meeting today. I appreciate it's out of date, it's from 23-24 and time has moved on, and we're working on our current data and performance information at the moment. So just to put that in the context for yourselves as well. Also to appreciate the data that's within the report is also being discussed at previous Audit and Scrutiny Committee and my Chief Social Work Officer report, so the data is the same. I wanted to just highlight really that the report does provide, it's a positive report, and it provides the multi-agency activity across the whole partnership, so it's not just social work, it's police, health and third sector included, of the work that we're all doing in Clerk Manager to keep children and young people safe. So you'll see from the report there's a number of highlights, some improvement activity and some of the progress that we've been making in relation to improvement work. We have a strategic plan that we've been, so it's the 23-25 plan, that is now being superseded. We're currently working on a new strategic improvement plan for the Child Protection Committee at this current time as well. So as I said, that information is appended within the Child Protection Committee. And I suppose just to comment on the really good collaborative initiatives that are going on across the partnership, in particular the Respect programme, Bairns Hoofs developments that's currently ongoing, and we've really embedded the Scottish Child Investigation Model, which is for interviewing children, and helpfully which is it's Forth Valley, and the team is undertaken from within Falkirk. And they were recently received an award from the Police Federation for actually the work that's been done. So it's only been implemented for a year, and we're already seeing some really good proactive developments and really good progress that's been made by that team too. So I'm happy to take, and Jim, sorry, I'll just introduce Jim. So Jim Young is the lead officer for our Child Protection Committee and Clerk Manager, and he does a lot of work to keep the committee progressing as well. So we've got Jim and myself here to answer any questions that you might have. Thank you. Councillor Forson.
Yeah, I've got a couple of wee questions, if you don't mind. On page 161 of the report, we're saying that the total number of care experienced children and young people in Clerk Manager as of the 31st of July 2022 was 266. And we're saying that's 26.3% of the entire 0 to 17-year-old population. That can't possibly be right, because we've got around about 9,000 young people, 0 to 17. So 26% of that is a lot more than 266. And I'm just wondering if I'm looking at the figure slightly wrong, because 266 of 9,000 is certainly a lot more than 26.3%. So I'm just wondering where those figures come from. 161 of the pages of the report. So it's, is it page 20 of the actual annual report?
Yeah.
Yeah.
I'm just find it. So page 20 of the
report, it's children looked after, and it's the first kind of purple box there. It's.
I think they had an updated report, and that may be what's causing the confusion, just the page numbers.
All right, okay.
Yeah.
So it's basically children looked after, and it's
yeah. Double check. I'm still trying to find the actual bullet point on the report. So
yeah.
Page 162, I think, Sharon.
So I completely get that we will have the 200, or will have been 266 looked after children, but that's not 26.3% of the entire 0 to 17 population.
There's a wee bit of confusion with the report because it's a different report that's, yeah, so. And it's not updated in my pack either, so it's a bit confusing. We'll just have to say, I suppose,
just on the details of the.
Sharon, can you switch your mic?
yeah.
Can I just get back on the details of that and I'll get it clarified and then I can actually say there's an update in relation to the particular rationale around that one, if that's okay?
That's absolutely fine, yeah. Yeah.
That's an SSG figure.
So it's, I'll just take notes, so sorry, it's page 161. So I've got a different version. Okay, thanks.
With apologies, folks, because we might have a bit of a struggle with the page numbers. Just,
Okay, and the other question I had really, and I suppose it's in relation to because Celia's kind of forward there as the chair, and basically saying like ultimately the role of the committee is to monitor the impact of the work and if we're making a difference to the lives of children and young people in Clackmannanshire. So I suppose the question I want to ask is, do the committee think that they are making a difference to the lives of children in Clackmannanshire? Where are we doing particularly well? Where could we do better? But also, Clackmannanshire Council is one partner within that. So I suppose we only have control over what the council does. Is there anything else the council can be doing to make that difference?
It's as you rightly said, it is a partnership, the committee, and there's the partnership does scrutinise, so it's at a strategic level. It's made up of senior officers within across the community plan and partnership. So that work is scrutinised within the Child Protection Committee. In terms of when we have subgroups, you'll see from the graph that all the different subgroups and working groups that are taking forward particular initiatives. So at each committee there, and Jim can talk about that, but we provide detailed reports on the subgroups, the work that's been progressed, what impact it's having, and any issues that might be arising. We also have scrutinise a risk register as well, which is very detailed. We also report into our Public Protection Strategic Officers Group, so that's made up of Stirling and Clackmannanshire. So this is Clackmannanshire only Child Protection Committee, but we still continue to have a Clackmannanshire and Stirling Public Protection Officers Group. So again, all our work that comes through the committee is scrutinised by that group too. And as well as wider partnership, because although it's about keeping children safe from harm, it's not, this focus is around the Child Protection Committee and its functions, but we also work really closely and we've got partners who also represent across our wider community plan and partnerships, including our Violence Against Women Partnership, our Alcohol and Drug Partnership, our Community Justice Partnership, to name a few. So there's really good governance over the work that we're doing in the committee. I can only talk from my perspective, but also in the role as a Chief Social Work Officer, we are making really good positive impacts. Jim might want to talk about the auditing work that we do. We have a cycle of auditing, which allows us to quality assure the work at an operational level, to allow us to assure the committee, the Public Protection Group, but also assure yourselves that the work we're doing is keeping children safe in Clackmannanshire. That's because I've got my notes.
Hi there. I'll probably just to give you a wee bit of reassurance, because obviously there used to be a Stirling and Clackmannanshire Child Protection Committee, and when I joined, I thought I was actually joining to be the leaders for both. I found out in an interview it was actually for Clackmannanshire only, and that basically meant that we had to set up a new Child Protection Committee and do everything from scratch, but obviously taking what we knew from Stirling. And I can put my hand in the hand and say we've got a very well established Child Protection Committee now. The work that we do, and I think
it was probably the right decision for Clarkson still to separate, because we can really focus in on the issues in Clackmannanshire, we can really focus in on the data, actually the quality assurance subgroup, and we get a chance to really say, well, why is the figures looking like that? Let's look a bit further. And it's not just for the council to do it. Well, for instance, we've got SCRA are looking at figures just now because they've noticed that they're getting more referrals from the police, from social work from the police. That goes against the national average. We've got more children going to hearings than the national average. So we look at things with a fine detail. And I think that will benefit the children from Clackmannanshire, because and from that, we have actions that we take on. We found that we were going to CPPM, so Child Protection Plan meetings, were quite high, but then we found that it was because the system was maybe not getting used properly. We had to put guidance out to staff to say, if you've got to go and do a wee bit more child protection investigative work, do that first before you press the button to go to a CPPM, because that's quite traumatic for families. So we can do that because we're looking at things really, really thoroughly. And it's just to give you that assurance. The work that's ongoing, we try and keep it Forth Valley wide to make sure that, because we have health and police that cover the 3 local authorities, and they want us to be consistent in each area. However, there is wee nuances that we have. Like, for instance, Clacks has its own plan, it's called My Plan, and I volunteer with our Clark's Voices, but it was the kids from our Clark's Voices that looked at that and helped us design it and make sure the wording was right. So a wee bit different from what Falkirk and Still have got. That was the children that were involved in that and telling us what they think the wording and what they want within it. I would say we are quite in the forefront of children's voices. Clackmannanshire had the Short Life Working Group for UNCRC, and there's a couple of people here that are part of that group. And we were at the forefront, and I can say that because Diane Cherry confirmed, well, she's no longer with us. She's not passed away, she's moved to another job. But creating a child-friendly complaints process, which I think we were one of the first areas to have that, and looking at the issue, making sure that we had something in place that children can have a voice. And it came from that the child-friendly front sheet. We looked at, should we write our documents and our guidance policies in a way that it's child-friendly, but a lot of our guidance documents are for practitioners, and we made the decision we need to keep them, but keep them in good plain English that folk can read and understand. We're having a child-friendly front sheet. So every Forth Valley guidance document or policy that's updated, it's Clacks kids that are looking at that, and we suggest, what do you think, is this is a front sheet? That's the document, and then comment on it, and they're great. And that's for everything that's getting raised in Forth Valley just now. And just, I had a laugh the other day, they were looking at Team Around the Child guidance, and these are things that we look at where, rather than going to the statutory measures, let's look at voluntary support for families and really focus on that. And Team Around the Child and family group decision making, we want families to be looking at that support first before things escalate. They need to look at more compulsory measures. So we're working on that, and I think the guidance document I've got just now is looking really good, and that will be attached to the Government Refresh training that's ongoing just now. But we had a couple of leaflets that was created, myself and a colleague from Falkirk, and we got the Clark's kids to look at it, and they said it's great, but you need to check your font, because down there the font's different. So they're very thorough, and we had a wee laugh at that, but they're good. And we've had to change things because they didn't like the wording, they didn't like the animation on it, and so they're very much involved. And can I say, are we making a difference? And I've been quite fortunate where I've worked with Strive for a period, and I managed the team, and we were sitting looking at the referrals were coming in. And the early intervention, you've got the early intervention team that sit on Strive, so there may be a referral for a mother that's struggling with her finance, and you dig a bit deeper to young children. Are they known to social work? No, or they are. And there's that offer of help from social work. That's early intervention, because if poverty or the person struggling with money, sometimes they can take it out on their children, and that's where your escalation comes. So I could put my hand on the heart and say that Clark's is very thorough. It's got a lot of really good early intervention ongoing just now, but we don't rest on our laurels. We're always looking to see where we can improve. We're looking at audit activity. For instance, you'll see that we're quite high for unborn children in the Child Protection Register. So our next multi-agency audit, we're going to look at that further to see what's the processes in place, are we getting it right? And off the top of that, Aberlour, the perinatal support for young mothers, that's now been offered to Clackmannanshire, which is great. And we're hoping that things like this and tying it all together and look at the learning will reduce children going on the child protection register. But will we get a world where there's no child protection register? I don't think so. I think if we ever got that, we'd all get a Nobel Peace Prize. So, but what we need to do is make sure that as less children are on it as possible, and the children that are on it are given as much support and the families as possible until it's safe to take them off. So, are we making a difference? I really do think we are, and I think we've got an absolute cracking Child Protection Committee. We've got great processes, and we've got a very strong connection with the Forth Valley partners and also nationally as well.
That sounds great, actually. I was really pleased to see about the perinatal support. I think that's really important. But I was wanting to ask, and I've asked it before, but because it's an out-of-date report, I know there'll probably be lots of updates already. But just on the Bairns House, what kind of improvement?
I can give you a good update. I chair the project group. I'm still on. I chair the project group for Bairns House. And we had funding last year that we used. We didn't use all of it because we couldn't get a consultant psychiatrist, consultant paediatrician to come in. It was all, we didn't think we were going to get all the funding that we asked for, and when we got it, we thought, right, we need to scurry and try and get people in place. The funding is very restrictive. By the time you get it, you're already within that financial year, and you've got to use it up the 31st of March. So anyway, we did great strides. Children First came in, and they've done a good review of the services and support. They've done a mapping exercise, a mapping report, which we'll be able to share. It'll be open for folk to read about all the support that is available for kids that are needing therapeutic support after they've been through significant harm, skimming and viewing processes. So that's something they worked on. They've also done the thing called Changemaker, which was looking at speaking to children that have been through significant harm in the skin process, and the ones that haven't, to get their views on how was it for you, how can we improve in Forth Valley, and that's provided an awful lot of rich data. We're still waiting for the final report. I saw the initial report, and they've spoken about 30 children, and some kids from Clackmannanshire were involved in that. I would say that Clackmannanshire was very good at providing information and get people to come forward. And that came out a lot through our workshops that we did with the staff and practitioners. So that's going to be a really influential report, because it's okay me saying to chief executives, we would like to have a Bairns House in Forth Valley. You probably all have to chip in, it's going to cost money. I think it's a great idea. And well, I've got a lot of other things to think about, thanks very much. But if you read the responses of children that say, I went through this process and it was horrific, it scarred me, the trauma and support wasn't there. If I had something like Bairns House, my life would be better. And that's what that report, I think, is going to help provide. Moving forward for this year, we're successful in getting funding again. So we do have a coordinator for another year who's absolutely excellent. And we've got money for 3 tested change areas. One is for speech and language to come in and assist the SCIM team for when they're interviewing children, because the SCIM process didn't really consider that as much. So we're seeing that as a really positive test of change. And we've actually got somebody in post that's part-time, in addition to the other job. The other one, and I'm quite passionate about this, is a psychiatrist therapist to come in. And this has been trialled in other areas and seen very positive, and it's for vicarious trauma. Social workers and police officers and health, if you're dealing with people that have been through significant harm, it's going to take a toll on you. And I think there's a lot of good things in Clacks that support staff with well-being and mental health, but I always think it can be better. And this will provide an opportunity for one-to-one support for staff that have been dealing with a really tricky situation and significant harm, where they can get that support. And I've already suggested that staff in Hull will get access to that, which I might be able to influence because I'm the chair of the project group, but that will be there. And then lastly, is to continue with the change maker care lead officer, which Children First were commissioned to do that for a year. However, we looked to see if we could maybe bring somebody in-house, either local authority or NHS, but the timescales that we have from conversations with HR, it would take us 3-4 months to even get a job out for advert. And by that time, we'll probably have lost these kids who we've been supporting. So it will likely be a direct award to Children's First again to continue with their good work. But we need to start planning for next year, because the development funding that we got last year and this year, I'll be surprised if it's available. So these are things that's like an update for Bears House. It's really quite exciting, but there will be some big decisions that need to get made in regards to funding. And we are looking at other funding schemes as well, like lottery and other options to see what we can to have a Bears House in the future. But it's a moving feast. It's exciting.
Charlie, you want to come back in?
Yeah, it's just to maybe know that this is a significant piece of work which you probably gathered from Jim's update. And then there's really good governance around this whole project. So it's fed into our Child Protection Committee and also our Children and Young People Strategic Partnership Group, but also our Public Protection Strategic Officer Group, which is a Forth Valley. And I think that's really important, because in terms of being able to get to a point of implementation, this will require resources. So it's good that we've got our Public Protection Forth Valley group overseeing this work as well on a quarterly basis to them. So just to note some of the governance around. So
that's excellent. I mean, I suppose we all know that children in a clinical environment shut down often and don't give good evidence. So I think it's an excellent initiative to move forward. But just on the back of that, in terms of the changes of legislation on corroboration and the different ways that you can establish corroboration, are the team all getting trained on that in terms of, when they're doing interviews?
I'm not sure the exact training they get, but it's joint interview. There's usually 2 members of staff that are there. However, there could be one that's just doing the interview. There'll be somebody else within that room with the recording equipment is. So I think there's corroboration there, but I'm not maybe 100% sure what your point. The point of these interviews are that if you do a really good video interview, then that child hopefully doesn't need to go to court to present and go into the court environment. But the kind of caveat, and it's a full room process, is that if they do, there would be a room within the Bairns House, and there's one we went to visit North Strathclyde, which is a lovely building, and their interview room for children is very trauma informed, very relaxed, and we would give an interview there rather than having to go into a court, which of course, I used to be a police officer, and it's an intimidating place for a police officer, never mind a child, to go and give evidence. So that's the kind of avenues they're looking at, the Bairns House, but it's looking at what's good evidence. And from what I see, it is making big steps, and I think it's making less and less children have got to go to court and give evidence under really difficult positions. So this will evolve the court process, and defence solicitors is probably the ones that will probably take maybe a wee more work to understand it, because they've got that right to cross-examine, and that's what they do, and that's how they're trying to support their client by that, and that's the hard one, I think, to change in the future.
No, thank you. Sharon, you want to come in again?
It was just to add, in terms of the SCIM model, it's very intense. It's not just a short, quick course, and we're talking, it's like 6 months intense, and it's social workers and the police work together on this, and we'll take cognizance of any legislative developments that are coming forward to make sure that they're continually being upskilled, trained, and working in the way that they need to meet legislative and new legislative, as you're seeing through the bill as well. So just to assure you that, and it's a national model as well, so we've got the backing from Scottish Government in terms of training that comes forward as well.
Well, thank you very much. And just any questions, Councillor Coyne?
Thank you, Chair. In the demographics section, it's kind of a follow-up to what Councillor Lawson was talking about. One part struck me, and it's 26.7% of primary school pupils and 38.2% of secondary school pupils have additional educational support needs. Now that's 1 in 4 and 2 in 5, which is astonishingly high. I mean, I've asked the question before about the methods of defining whether we're over-prescribing. I don't know if we are, but that's a question. But also the fact that it's a smaller percentage in the younger group than in the older. Is that COVID peak moving on? Even if those numbers are not right, it's a relative.
We'll get someone from education that will call in online, and give a little bit of an update. So this information came from the demographics and previous reports, so we'll be able to give you.
Yeah, if you're okay, if I could come in on this one, thanks. In relation to the additional support needs being greater as you go through school, sometimes that these come apparent as you go through school, and that if you are, say, been diagnosed with as dyslexic learner, it is probably more likely going to start show as you start doing more writing as you go through school. That's a big group of our learners in our schools. And just for that example, say we have many there that have been assessed as having dyslexia. The supports can still happen in that class with the support of the class teacher in many cases, and doesn't lead to additionality as such, but is in the practice of the class. But sometimes, yes, there is additionality absolutely needed. That's why we've got lots of learning assistants and things. So that's just one example. There are many different additional support needs, but you will see these increase as you go through school. 40% is a large number. It is reflective of the need in the area, and there is a real increase across Scotland in relation to this. Part of it's to do with better diagnosis and expertise of our professionals as well, which is pleasing. So I hope that gives some clarity to that.
Yes, thank you, Colin. It does, but I mean, obviously, it begs the question: if this is a trend, and it's 40% this year and 45% next year, whatever, if it's moving in that direction, that's going to have fundamental implications for mainstream teaching, is it not? I mean, it's going to have to integrate with ASN.
Absolutely, and that is some of the challenge we face, and making sure that our staff are really well skilled in that space, as well as our learning assistants, so there is ongoing professional learning. Scottish Government have recently released some additional funding in relation to additional support needs, which is in tune to about £250,000 to Click Manager, approximately, coming in additional this year. Of course, we would welcome far more. Where we're seeing a real spike in need is related to support needs related to children that have been diagnosed with autism, and that is where, I suppose, locally we have got to really make sure we are meeting that need, because that is a significant increase in the nature of the needs within autism.
Absolutely, thanks for that, Colin. Sharon and Jim, on what would be your page 18, I think, but it's the Children's Service Plan Annual Report page. It's 157 of our report. It's a little table at the bottom showing the number of courses delivered, the attendance, multi-agency training with young. And it's looking at the trend through the quarters, how it seems to be tailing off. Is that because you're saturating your market successfully, I mean, or is it a reduction due to people not being interested or financial constraints?
Yeah, we've actually got a very good training programme at Click and I know that from speaking to the lead officer from other areas. We've got a very healthy training programme, and a wee bit of context, we in Southern Clark separated and became our own Child Protection Committee. We created 2 calendars, so Southern wanted their own training calendar and Clark's wanted ours, but it became quite evident that there's the Learning Development Advisor who covers both areas was getting stretched, so he was having to do 2 days for one training programme that the staff would get taught the same thing. So we let it try and work. It didn't work, and we were always keen because I managed, and the Learning Development Advisor, and he was pulling his hair out trying to manage everything. It's now a combined training calendar again, which is the right decision. I think it's the right decision. We still are on CPC, but I think the training calendar thing, without a doubt, is correct. So that probably doesn't answer your question about folk not attending, but it does fluctuate. That we do know that there's operational stresses where on days where you're expecting people to turn up, something might happen that's urgent you need to attend to, and you've got to expect that. And generally what we do now is if somebody doesn't turn up, and you'll see that there is usually quite a good attendance of people want to come, but then on the day you have less attending because of operational issues. And we're usually quite satisfied. It's not because people forgot, it's because they're on duty, they're working, and something might come up that they need to get pulled away from. But we are looking at how we can improve that though, and a lot of it's to do with this trying to allocate time the best you can to staff. And this is multi-agency staff as well as third sector and education, etc. So you picked up on that, but we know that as well, that we would like folk to go more to training, but we are realistic that there are pressures at times. But the good thing is we've got a good healthy calendar there, so if they can't fit into that one, there's usually another training course that comes up that they can fit into. So, and it's not good for their personal development. So I don't know if I've answered your question.
Well, I'm going to switch off. Yeah, I mean, the most significant decline is in the bottom line, the total number of completed child protection. It's gone from 167 to 11% of that roughly. That's a hell of a drop over a year. I mean, okay, it's only 1 year we're looking at. There could be seasonal waves to this. So I'm just looking for some comfort that there's not something fundamentally wrong with the attractiveness of these modules or the willingness of people to step up and take them on.
Yeah, I think it's really about capacity. We review this, so there's a training subgroup which Jim oversees. It's multi-agency across. Some of this is not just our local child protection committee, it's wide, it's both Valley related modules and things here as well. So we review this and we have quite a lot of discussion at our quarterly child protection committee in relation to these numbers, and continually look across our partners how we can ensure attendance, and because this is about upskilling all staff, their knowledge around child protection practice, and that they're competent and confident in undertaking it. So it's not just about a child protection course, there's a whole range. You'll see the different ranges across the suite. So it's important that we have all our staff across the community planning partnership undertaking training, and when we're speaking with our partners, and they are reduced, I'm scrutinised from the social work perspective, but there's police and third sector health colleagues there as well, in terms of what are the barriers to getting people to attend. And as Jim's saying, we get a lot of people completing application in high numbers, so we look at high numbers who've all said they were going to come, and then on the day there's a dip. And that's the issue that we're continuing to try and improve on, that people can actually protect the time. And we're speaking with our senior managers and team leaders as well to ensure that the staff, when they get operationally, are given the protected time to commit to the day that they've for attending. So it's an ongoing discussion at our quarterly child protection committee, and also our public protection chief officers group also discuss that same issue as well.
I mean, these data, can you switch yours on? I mean, these data are a year old now. Are you reasonably confident that if we were looking at the last 4 quarters that we would see a big change?
We've put processes in place now that if somebody doesn't turn up to training, that there's line managers email to say, can you confirm why they never attended? And it's not creating a hit list or anything like that, but I think that has improved things now, because I'm not saying before that folk just didn't turn up and they didn't bother. I'm not saying that, but I think now that folk know that if they don't turn up to a training programme, that we'll be contacting a line manager to have a conversation with them to see why they couldn't attend, and are they going to attend at the next course, because training is so important for staff, and legislation changes all the time, and you've got to be abreast with it, and you've got to, and a lot of it comes from learning reviews and practice. So we want staff to be fully updated. Yeah, it's a work in progress, is all I can say.
Councillor Moore?
I was just wondering, could the reason be, are these like yearly courses so that, you know, you did it last January, so you've got to do it in the following January sort of thing? Is that partly maybe one of these reasons that it's just the way that it kind of works, and when you've done it and completed it, and then the next time?
No, they're not mandatory yearly courses, and we have them, I think, maybe 4 times a year to make it quarterly, so it's easier for staff. The only mandatory courses are the ones that we have on Clark's Academy. So it's an ideal world. I'd like everybody to turn up to every course and be well trained and totally prepared for their job, but you know, I'm realistic as well that there is going to be times when folk are prepared to go to training and they get a phone call of distress and they need to react to it, or something happens that they need to react to, and that's the world we live in, and I think we've got to accept there's going to be a bit of that. But I think the figures that we had probably a year ago, I think will be better now, because we do have that challenge in the line manager to have that conversation, that supportive conversation to say, why did you not attend and what happened? And from what my knowledge is, there's always been a good reason. It's not been, oh, I forgot. There's always been a good reason for it. And that's basically the nature of social work.
Can I also ask, so how are we getting this information out into communities? Because a lot of the times, like, there's been loads of stuff about kids, antisocial behaviour, criminal behaviour. That's a child protection issue. And sometimes, like, the stuff that I'll get is that, oh, the police said they can't do anything, but that's because maybe the police aren't the agency that's dealing with it, it's another agency within it. And it's just trying to get that information out to the public as to how these get dealt with and looked at, because I think we feel that nothing's getting done, whereas obviously there is a lot of work behind with the young person, trying to help them out and kind of see what other kind of maybe trauma or, you know, what's going on. Like, how can we get that out to the public to kind of get that better understanding of the situation, that it's not just down to the police arresting and charging a young person?
Yeah, and as you said, it's a child protection issue, but it's that everybody's responsibility. It's all our community planning partnerships, our Violence Against Women, our community justice partnership. We don't have a specific community safety partnership, but it's about how all our partnerships are ensuring that we are communicating to the public. So, for example, we've got our community police, so they're based in the schools. They go along to community events, they go to the local community meetings, and it's about ensuring that, you know, for example, our police partners are providing that information too. So it's not just one specific area. I mean, we communicate through, we don't have like a newsletter as such that goes out to the public. We have spoken about is there something we can do from a front facing, but it tends to be, as you say, when there's, I think you're talking about the specific antisocial, when it's antisocial behaviour, for example, social media does get involved in it. But I think from a comms point of view, there's maybe more we can be doing, not just from a council, but also from a community planning partnership level, through the Alliance, collectively, to communicate the work that we're doing.
I would say in regards to the community police officers that are within the school, I've not been to a community event that I've ever seen them at, to be able to kind of maybe talk about what they've done or anything like that. So I don't know if you're able to maybe communicate with them that might be a good idea, kind of going out to like the community councils and whatnot, because that's a lot of the time where this stuff will kind of be brought up. Because as I say, I've never been to one that they've been at.
Can I just add that the Family Wellbeing Partnership and Planet Youth meet regularly. There's a really good array of third sector that they're in the community. The school-based officers have been attending that, and they have open discussions. So that is happening. I used to be a community inspector, and you were saying that the community officers don't turn up to community council meetings. Cause that was something that we always ensured. So I'm a wee bit surprised at that, but I know that things have changed since I've retired, that maybe it depends how many meetings they've got to go to and what their staffing is like.
Colin, were you want to come in on that?
If I can get my mic off. Yeah, where I see them really engaging with the community is some of the information evenings for parents and carers across our secondaries, where they've increased that recently as examples in Easter holiday during transitions and reaching out to P7s, parents and young people going into school and offering additional time. But I think your comment sort of leads me to think that maybe a sort of strategic gap to maybe some of the community's work and some of the meetings that you're going to. So I'm happy to feed that back to them, but I do feel they offer really good service to our parents and young people in the school, but it can get down quite to that granular level for individual families, if that helps.
Just want to, I'm not getting at the police because I know that they're very time constrained, and a lot of the community officers are getting pulled into emergency response. So, but I do know they do have challenges getting to the community council meetings. I know that one of them they're able to get to, the other one that I go to they can't get to because I think it's usually their day off. But it was just more that's the community police officer rather than the school one. I don't think I've met the police school ones in my area before.
Councillor Quinn, you want to come in?
Yeah, thanks. I just got a bit of a follow-up to, again, the training stuff, following off what Councillor Coyne and Councillor Wall were asking about it. We're saying this training, oh, this is really important, it's really essential, this training, but then you said it's not mandatory. That just seems completely contradictory to me and sending mixed messages. Can we not make it mandatory? Can it not be made mandatory? It is really important, and you definitely want people to attend these trainings. Should it not be mandatory, and is there something that's stopping it being mandatory to force people to go to like either a certain number or certain ones of these modules every so often?
Certainly for social workers, the word mandatory, it's probably there's an expectation that they attend, and they generally do, and that's part of their continual personal development, and that's the discussions they'll have with their team leader when they're having their meetings, is to ensure that they attend this training. For instance, Safing Together, we want all our staff trained in that. It's a 4-day course, so there is a kind of abstraction that you need to think about when you put staff to that, but we've been very good at getting our staff to that. This is multi-agency training, so this is health, this is education, this is third sector, so trying to make it mandatory for them is not in our gift, but certainly social workers know that there's an expectation. So I suppose it is mandatory for them in another way. They know that they need to attend this training. It's part of the process when they get their induction, when they join us, their student. Social workers know that, they attend training. So I know the word mandatory makes it, you will go, but there'll still be occasions, even if it's mandatory, that something comes in that they need to cancel and go and deal with it because there's a family crisis or there's a court case that you need to attend to or something. So I don't know if I've answered your question properly, but
I think you've answered it then. So it sounds like then, just to make sure I've got this right, it sounds like then, you know, they're working with their leadership and there's an expectation that they do certain things, and obviously there'd have to be some kind of justification if they were not going. And then that's what you were saying there, there was going to be follow-up, people that attend training sessions and that, so we were kind of basically kind of checking in that, you know, there was a good reason, that's fine, all that kind of stuff. Well, that kind of makes sense, just when you said it wasn't mandatory, it was kind of, it's in the wrong message, but the point you're saying, it sounds like it basically is, unless there's a good reason that we can't, and then it's being followed up on anyway, so that sounds like it's all good. No, thank you very much, that's all I just wanted to.
Thanks, Chair. It's just a wee one. It's on page 7 of your new report, and I think in a slightly different page of the old version. It's the page that starts at the top with continuous improvement. Are you with me? It's near the front end, page 7, I think. And it's got a section called strategic planning. And I'm curious about the second bullet, which is incomplete.
Yeah, I actually read that last night and picked up on it. I thought, I bet that gets picked up today. So it was a taste, so thank you. That's about making and maintaining links and planning, and that's for emerging issues, basically. So that's how that should finish off. And emerging issues, things like, well, in Forth Valley just now we're looking at sextortion, which is an issue. Sextortion isn't a crime, a specific crime, but it's a thing that happens in for children targeted. So, for instance, that's an emerging issue that we need to make plans and work together to focus on. And for instance, the Fearless campaign that came out, which was widely advertised, was an excellent campaign, and that was something that was national, and the school-based officers have worked in really hard with the schools in promoting it. So it's about emerging issues. So it means that we're ready to plan for emerging issues. And there's always things that are coming over the horizon that we need to be ready for and prepared to work together for. And it's not just Clark's Council that need to fix it, it's everybody's responsibility.
So we rewrite that as links with other bodies, is it? To plan for emerging issues. So, thank you.
Thank you so much for that, and I'm very happy to move this paper. I think it's really high standard. I know it's slightly out of date, but I'm really encouraged to see all the accessibility for children within that and the engagement that's there and the easy to read materials and just the scale of work that's been done. But just on questions there as well, I was really encouraged to see about the preventive work that's been done, particularly with people in, when sort of perinatal care. I think that's excellent, and obviously the ongoing work that's done by child protection in terms of making sure that children stay at home where they can. It's always been something. So, and the move towards parents' house. So I'm really encouraged to see all the really innovative moves again. And it was great to meet you, Jim. It was really good to hear a lot of your kind of insights, which were really helpful there. So, really pleased to hear all that, and excellent as usual, Sharon. So, and the rest of the team. So, really pleased, and I just think this is an excellent report. So, thank you. Councillor Bolton, want to second?
Yeah, happy to second. I mean, I think this report just highlights a lot of the work that's going on here, and I do think it's probably a good one for the Alliance as well. It's probably on the agenda for that coming up. It's sometimes hard to quantify what you mean by you're making a difference. And I think that's why I was asking the question, because it's easy to say that, but I think it's clear with the answers that were coming out, it's just some of the differences that are being made. I think you could have probably, kind of blown your own trumpet a wee bit more and some of the things that are kind of getting done there, because I do know that there's significant work going across the area. But, it's a good report. I think it highlights, as I've said, the work that's ongoing. So pleased to see it, and please do give our thanks to the Child Protection Committee, because I do know there's a lot of work goes on there.
So we're open to debate. Would anybody like to debate? No. Happy to note? Yeah, thank you. You'll be glad to know we're having a 10-minute comfort break, but we'll need it. So we're in the session so far. See you back in 10 minutes.